Did it go? I guess. Did he say go, Neil? He did.
They come in the bar now. They laid
I like-
outside. They love the call.
Big fans.
If I could get everyone's attention, thank you so very much for being here. And again, we have a full agenda today, so we will get started. The first thing I'd like to do on our agenda is to ask Chaplain Leanne Franklin if she would come up. And I just want to mention something as you're coming forward, Leanne. 7:30 this morning, I was with several people out in that audience that works for JPS and JPS Foundation over on the east side of Fort Worth, and attending a community breakfast and some of the social stuff we do in this community. And I think sometimes we get so caught up that what we do so fantastic within the walls of JPS, but JPS also goes out to the community. So I think I had breakfast with 5. I see several of them here. I see Michelle, JRCU. I know there's some others that were there this morning also. So again, JPS just continues to support and do things in the community as well, both inside and off our campuses also. Leanne, it's all yours. Thank you.
So much. Yes, inside, outside. This week has been an especially busy week. We've had since Monday 19 deaths. It's been a very hard time. So for each one of those deaths, think of the doctors, the nurses, chaplains, the social workers, and families. So busy time, always remembering why we are here. Also, 2 weeks from now is Thanksgiving. I just looked at my calendar. So with that, let's pray. We gather this afternoon in a spirit of gratitude. We are so grateful for the challenges and opportunities we have before us. So we ask that you be with us this afternoon. Inform and open our minds, inspire our hearts, unite our collective vision, so that together we can be the JPS that our communities most need us to be. It is with thankfulness and the joy of service that we pray. Amen.
Amen. And thank you. Would you please join me in the pledge? Anybody sign in, Robert? All righty, that we're taken down to item number 3. I've been advised there are no citizens wishing to address the board today, and which will take us down to item number 4, which is the approval of the minutes from the previous board meeting of October the 10th was provided previously. If there's any suggestions or recommended changes, we'd entertain those. If not, I'd entertain a motion.
Move approval.
Mr. Bose on the motion, second by Dr. Weber. All those in favor say aye. Pass. Thank you. Board chair comments, and I'm going to make this a little brief because, Robert, I don't want to take away some of yours. But the first thing I wanted to say was this was Veterans Week, and this hospital, in my 3 years as chair, this hospital always recognizes our veterans. We appreciate the men and women throughout the JPS teamwork that have been veterans. As I said here today, I know as I look around this board, I might just take this point to ask this. If you're a veteran in this room, would you please stand? Whether on the board or in the audience, either one. Chuck, thank you. And I know Reverend Emerson is not here today, he told me, but thank y'all for your service. And, you know, DT, I was able to follow you on about a 10-day trip you just made. And if I get this right, I think it was Lieutenant Colonel James Williams, who's 75 years old. If you caught Channel 4 News, DT's actually a movie star but he wasn't on there to be a movie star. He was part of the Valor organization that takes our veterans, and they actually, I think Lieutenant Colonel Williams had been at the Hanoi Hilton. And it had to be a very memorable time for you, DT, and appreciate what you did to take those and be a part of taking those veterans back. I saw the story on the news. I know y'all were recognized in the Dallas Veterans Day Parade, so thank you very much. And if anybody wants to see the link, we can certainly provide you. It's really a great story. So DT, thank you for you doing that also. The only other thing I wanted to mention is that I did go by past Tuesday and I attended the JPS Foundation, and obviously the Honorable Laura Wheat chairs that board, and my entire intent for going by was to tell them thank you for what they do through the year. Sometimes they're really part of us, but sometimes when they're meeting in other buildings, Robert and you and the staff do a great job. JR, I know that is something that you're really managing and part of now underneath your position. So again, I went by to thank them for all the work they've done this year in helping us. So as we get into the Thanksgiving time, there's a lot of need with the freezes, and we know the homeless and a lot of the people are needing our services, and the foundation steps up and provides that. So to the foundation board, I want to stop by and say thank you. So with that, we're kind of thinking about, I'll end by saying we have Thanksgiving coming up. As Leanne indicated, it's hard to imagine 2 weeks ago, is away. this year, just a year ago, we had just kind of been elated that a certain bond package had passed, and I think this has been the first meeting after the bond package, and we were all, wow, here we are a year later, and we're talking about Thanksgiving again. So again, appreciate everything everybody does, and Robert, that's mine. I know you want to also mention something about what we do for our veterans here in the organization.
You bet. Thank you, Mr. Chair. CEO report, we did and have a Veterans Day breakfast, which is an actual really powerful ceremony. This year we had Dr. Robert Fromm as our guest speaker, and Dr. Fromm served in the United States Air Force, and he was stationed in Iraq. He was part of a unit in Iraq that saw some of the most difficult tragedies that one can see in wartime, not unfamiliar to Dr. Weber and his time at the MASH unit in Vietnam. And those are challenging times. And for those of us that did not serve, you just have to dip your head down in prayer, and thankfully that we had people like that protected me, who never was called up to serve. And Steve Simmons and the rest, it's very, very powerful to me, and I don't ever let that go by the wayside. So for those of you who protected my freedoms, I am grateful, and I know everybody else is as well, and I'm thankful for that. But we had a great ceremony, and Dr. Fromm did a good job. He said he was nervous, but we didn't indicate any of that. And I always thought that was ironic that the man was stationed in Iraq, and he said he was nervous to get up and speak. So the irony did not go unnoticed. But super, super guy. And at some point, we'll have Dr. Fromm and some of our other chairs come by to meet you all, because we have some of the best chairs and just really good people, aside from what they do at JPS and saving lives. That's what they do outside of that. To those in the audience, I too will not probably see you all before Thanksgiving, so I wish you all the very best. I hope you have a great Thanksgiving, and you have time with family and friends, and whatever business you're in, and I'm not assuming that any of you are in the contracting or architectural or consulting business. I hope you will take some time away from that and just have family time and do whatever it is that is enjoyable for you, whether it's cooking or eating, and do it with loved ones. I have the great luxury of being thankful every day because I work with some incredible people. The executive team is one that I would stack up against any. The 6,700 employees that we have here, you're not going to find better. And it always excites me when people recognize the executive team outside of our own. Pia Walker was selected as the 2019 Individual Diversity First Leadership Award winner. And there was a major ceremony at the Hyatt Regency. I'm really excited. The only thing that doesn't excite me is the Hyatt Regency is located in Dallas and not Fort Worth. But it was a wonderful ceremony. Bill attended that with Pia on the 24th of October. But I think a round of applause to Pia Walker for the incredible work she does. Pia, thank you for all that you do. And our Veterans Day ceremony was put together by Michelle. Michelle Greenport has done some amazing things in her role as our diversity and inclusion officer, but she also does events like our Veterans Day. And at that event, not only did Michelle orchestrate a great event, but we had Trisha Elliott, who sang the Star Spangled Banner. And if you want to hear somebody sing, you should hear her, because she is really, really good. And she gave us a rendition that was powerful and moving, and very different than the way most people sing it. You could understand every word she said, because most people just slur a lot of the words together, because I don't think it was a song written to be sung well. But when Trisha Elliott sings it, it is really good. And so she rocked this room with her rendition of the Star Spangled Banner. So thank you all for that Veterans Day ceremony that we had, and Pia, congratulations to you. We all on the executive team love it when one of us gets called out by the community for an award. The other thing that we've done is you all as a board have helped us immeasurably to do this, but part of the biggest hill we continue to climb is trying to figure out ways to engage our physicians. It has always been a challenge at JPS, even dating back to the 1960s and all, when you had community docs that just came in and did community volunteer service here. And so the ownership model of JPS was never really firmly established. It was, let's go into JPS and help, and we were proud, and that's wonderful for the tradition, but there never really was, I am part of JPS. And so this board and this administration has worked excessively hard to try to get engagement from our physicians. We started out by doing a TCU cohort program and bringing physicians in and giving them some management skills, some communication skills, understanding finance of healthcare. And Chet Schrader was part of that program. Tim Kramer was part of that program. A lot of our doctors have become a part of that program, and it's worked exceptionally well. Tim Kramer and Laura Burnside have now gone some ancillaries of that very program, and we have the Patient Experience Mastery Program, which brings in physicians. We have a 10-session course for physician and APPs and operational leaders within the network. And we talk about collaborative learning sessions, what you do to make this place better. And we look at enhancing patient experience, what it's like to be the patient, what's it like to communicate with a patient, the fact that sometimes 5 seconds may be all the time you get, and thinking about smaller things that mean big things like eye contact, and how you talk to that patient and communicate with them. We had 76 physicians, APPs, and operational leaders successfully graduate from that program. In those cases, we empirically can now see patient satisfaction scores increasing with those physicians. So to Tim Kramer, who does our physician engagement, that's a tough challenge, because it's sort of a gray area. How do you get people involved, and what do you do, and how do you engage them in that? That's not something we should take for granted, and it's not something that has a path cut in front of it. So Tim is cutting a path where there hasn't been one, and I appreciate that. So what we're going to do is we wanted the doctors to speak, and some of our APPs and our operational leaders to speak individually. So I'm going to have Jeff in the control room queue up a video that our communications team put together. And that's another thing I want to comment on before Jeff runs it, is our communications team is stellar at putting videos together. A service that we would outsource before, we now do in-house, and they do it really, really well. So my hope is, with that kind of introduction, that it cues up right and that the sound is with it. But if there is no sound, it's not our communications team. It's this structure here. So Jeff, if you'll run the video.
We know the ones at the talent show.
It was light. It was life-giving.
Brings us all together as a team.
The way you sit in your chair, writing notes in front of them.
It's reignited the passion, it's reignited the excitement of taking care of patients. And we do that well at JPS. So the Patient Experience Mastery course is an innovative means by which we can pull together our community of providers and clinicians. It galvanizes the trust. It allows us to work together to find best practices and new ideas to convey pearls of wisdom and skills and tools that we use to improve our patient care. We look at the needs of the patients from their perspective, and we talk about better ways to listen and better ways to connect.
It really helped me retrain my thinking about every patient experience that I had.
It was more introspective. It was light. It was life-giving. You as a human being, I didn't expect to learn more about myself and how I approach people and how I come off to people and really think beyond patients, beyond patient care.
I think all of us come to work every day really wanting to give our patients that feeling of acceptance and that we care so much about them, because we do, but sometimes our body language or the way we enter the room or the way we speak with them doesn't always portray that. And so for providers, it can be very frustrating because we want so badly to portray that to our patients. But sometimes just with simple little changes to the way we act in front of them can make a huge difference.
It's really given me a new excitement to use all the tools, and one kind of builds on the other, and then you end up doing several, and you do them over and over, and you see the patient's reaction, and you see them relax, and their joy on their faces just kind of gives you more joy as a provider, and it's really kind of put a new, renewed energy into my job and what I do every day.
The power of connectivity is remarkable, and this course has taught us more and more how to do that.
Even though we all work in different areas, we all have a similar purpose, and learning and hearing what they do and how I can put that into practice in my own area was invaluable.
It was a really good program for us. There's a couple things I want to note, particularly for those of you in the audience. Elizabeth Smith. Smith is a common last name, but that also is a direct descendant of John Peter Smith. She is in that lineage, and she and another sister and a brother also work at JPS. And her brother does actually look a lot like the man John Peter Smith, especially when he had his beard. The other thing I want you to note in there is that, and it was not by design, but you actually see Jay Haynes gelling in and washing his hands. That's an important aspect of care. And you all are going to hear a little bit more about that when Dr. Stevenson gets up to give you a bit of an update as well. But that was a really good program, and I wanted to let you all know that. So, Mr. Chair, that's all that. Unless you all have questions, that's my report.
Any questions for Robert? If not, we move to item number 7, which is the medical executive staff meeting, and Dr. Schrader.
Yeah, so I have one item on the agenda for consideration of the board. Credentials Committee has referred to this board the consideration of approval of a clinical privilege change in allowing lead extraction. So to kind of explain, electrophysiologists put in pacemakers, and the pacemakers have wires that go down to the heart. Sometimes when those pacemakers are no longer needed, there's a change that needs to occur, you got to be able to pull the wires out. And so what we're essentially allowing is with a laser procedure that they have training in to allow them to extract those leads out of the heart before they would need to replace a pacemaker or remove it completely.
Yeah, the laser gets rid of the scar tissue that surrounds the pacemaker wires. And you have to deal with that scar tissue before you can yank it out. So that's what it's,
Or you yank it. Is that a
Yank
medical?
is a technical term.
Yeah, I was asking about that word. I was like, any questions, Chad? If not, I've got a motion from Dr. Weber, second by Dr. Simmons. All those in favor say aye.
Aye.
That is, by the way, the first procedure I fully understood.
Yanking it
The
out.
yank part,
Because you talked about yanking.
yeah. I would say it's the Aggie in you, but I won't say that. But anyway, Chad, anything else?
No, I'll yield my time to Dr.
Super, thanks so very much. Speaking about Dr. Hosper, we'll go to item number 8, and before we do that, before Michael comes up, Robert, I think you had.
Yeah,
something
what
you'd
we're
like-
going to do today, if you will allow us to, Dr. Hochberg and Dr. Stevenson have been working diligently on some key quality issues. And I thought it might be, with the direction of Dr. Hochberg and Dr. Stevenson, a really good idea if you as a board and those who are watching us live streaming and those of you in the audience had an idea of some of the challenges that we face, some of the opportunities we will have, and some of the things that we need to do to deal with infectious disease control, to deal with challenges with CAUTI and CLABSI. So if you could, we're going to have Dr. Stevenson come up. He has a few slides. And as he comes up and Dr. Ahrq comes up, one of the things that I wanted to tell you is the most challenging thing for Dr. Stevenson is not to look the professional way that he looks, because usually he's in scrubs. He looks very good in a suit. He's an articulate man. He's an intelligent man. The hardest thing for him is to reduce this to a minimum amount of slides. That goes against his very grain. So I will tell him in advance, I am so appreciative of him, because it is a much better slide presentation in his eyes if it's 75 slides rather than 14. So to that, Dr. Stevenson, I want to thank you, and I think it might be helpful if you introduced your role and what you've done, and also the time you've been at JPS and the role you've played even prior to this position that you currently do an excellent job in.
Before you go, Rob, if I may, Zim Zimmerman and I attended the Quality Awards presentations, and it was quite cool to see all the folks and all the work that goes into it. One of the things that was said when Michael Ahrq took the stand was that he got no applause when he came up to speak at board meetings. So for Michael...
Yay, Michael.
Somebody loves me. Finally, I feel it.
We love you.
Finally.
Hugs are coming.
It was a fairly abbreviated staccato applause, so I'm not to what extent you're loved.
I take anything that I can get.
Yeah, all right.
So before I turn it over to Rob, and so part of the reason I'm up here is to make sure that Rob does keep it brief. But I do have, sorry, Rob. I do just want to make one very brief Acclaim announcement. On December 2nd, which is the week after Thanksgiving, we are, our new Chief Medical Information Officer will be joining our organization. He is an internist by nature. It is a role and a position that is really meant to continue to remove the silos that exist, build integration, and achieve a true inclusivity between across departments as we look at technology and work between our providers as well as our IT folks and all our individual stakeholders. So this individual will report directly to me, but will work extremely closely with David Mendenhall as we ensure that our systems function properly, effectively, efficiently, and on behalf of all our staff and our patients. So on December 2nd, he'll be joining us and begins to acclimate to the organization. He's coming from MD Anderson. He's the Associate Chief Medical Information Officer there. And as I said, he's an internist by nature and will also be doing clinical time at our Oncology and Infusion Center. With that, I will turn it over to Dr. Stevenson.
Thanks, Michael. My name's Rob Stevenson. I've been at JPS now for about 15 and a half years. I'm first and foremost a surgeon. I do trauma and acute care surgery here, as well as I have done a lot of hepatopancreaticobiliary surgery here over the years, which is liver and pancreas and, sort of complicated stuff for cancer. At the end of 2017, I was named Vice Chief of Surgery for Quality, Safety, and Patient Experience. And then in April of this year, especially those of you on the Quality Committee know, I was asked to step in as interim Chief Quality Officer, which is a position I've held since that time. And we've made fairly good progress on a number of fronts, driving towards becoming a more high reliable organization, which is a goal that really I think all healthcare organizations should have. And to that end, there have been sort of two great pushes, and one is sort of a continuous search for our vulnerabilities as an organization in terms of patient safety, and then the other is we're asked to do these things by all these organizations, Leapfrog, CMS, and all that. And what they're really, and they ask us to do this specific thing or that specific thing, but behind that is a why for why they're asking us to do these things. And the why really comes to what kind of organization they're trying to help us become by those asks. So I'm bringing before you today a couple of items, actually 3 if you include what we're going to present in just a little bit with a never events policy in the policy portion of our meeting today, but 2 items which Leapfrog has asked us to do, and they ask us to do it for a very important reason, and the reason is that the first is we're going to talk about the Ahrq Culture of Patient Safety Survey, which is a survey we conducted in June, and what they want there is they want us to listen to our employees, what they're saying about what they see in terms of our culture of safety here, and then they want us to respond to that. And they want us to respond to it so seriously that they want us to bring our plans to you as the board to show you and the public that we are doing what we need to do to become a safe organization. And to the point, organizations with better scores on this survey have better results. There was a very nice paper in the Journal of American College of Surgeons from August which showed this very, very clearly. And the second is we're supposed to bring you our results and plans in hand hygiene. And so we'll do that also. This won't take very long, neither of them. But the second is that in terms of infection prevention, there is nothing more important to do than wash your hands. Nothing. And we've known it since the early part of the 19th century. We're still having to learn it every day today, and I wanted to show you our plans on that. Can I have the slide? Oh, there we go. Great. So the first, we'll begin with the Ahrq Patient Safety Culture Survey. So we ran this for 2 weeks in June. It's designed to help us assess how our staff perceive various aspects of patient safety culture. We ran this survey through NRC, and the last time we ran it through NRC was 2015, so we have a comparison, apples-to-apples comparison from that survey that the company was able to help us with the analysis. The thing that's really, I think, shocking to a lot of people at JPS, because our culture, the spirit of JPS has developed so much over the last 4 years, it's a bit surprising to people that the results on this particular measure did not change very much over that time period. And I think that is something that we really need to give our attention to. The one really good piece of news on this is that our employees and physicians really turned out and answered this survey. So if you have a survey response rate, according to NRC, of about 30%, that's a legitimate survey. We really went well beyond that. 47.2% on the hospital, 60% on the employees, and our physicians, remembering that many of them don't come here very often. We were right around 30% with our physician response rates. So this is really good information. As far as the results, there are some things to really focus on here. The top 3 boxes and then the 6th from the top, I think, are the most important here. Our employees still don't feel like they can communicate openly about what they see in terms of safety. They worry that if they report error, or if they're found to have committed an error, that they're likely to face some punitive response. Those aspects, those things that they're telling us are warning signs to us that they don't feel comfortable talking about the things that are really going on. And if we don't know what's really going on, then we're not going to be able to come up with the right plans to improve. If you look down at the bottom, we have made some improvements. As you can see, people feel like the team works well, they feel integrated. So that's a good measure of where that overall culture has moved. But in terms of that feeling that they can really let us know what's going on, there is definitely some hesitancy that we're seeing. And then the survey also included a whole host of comments from our employees, and here are some of the major themes. They feel that we're a reactive rather than a proactive organization. In other words, we wait for something bad to happen, then we jump all over it. But in advance of that, we aren't looking at our processes, in their opinion. They, again, feel concerned about whether they may face retribution for speaking up or making errors. They don't know what happens when they make safety reports. They don't get feedback. They don't feel, we heard from a lot of our employees that they don't feel personally safe in our environment. A lot of comments reflected the challenges of managing a large behavioral health population in the setting of the acute care hospital. And that goes to having their techs pulled to be sitters, and that makes them busier and makes them feel like they're running around. Poor and inconsistent handoffs and handovers, and then the challenges of ED throughput, which are very significant here as well. So we spent several months coming up with a series of robust action plans to address these things. One is to move towards what is referred to as just culture, where we break down those barriers that seem to be preventing our employees from coming forward with the things that they see and know. We're training them. We actually have just finished training roughly 10% of our employees, including nearly all of our leaders, in failure modes and effects analysis training. So that for those who've been involved in high reliability industries, this is a commonly used technique to evaluate processes and look for the ways in which it can fail, assign severities to those risks of failure, and address them. We're completely reforming our events reporting system, and David Mendenhall and the IT team have been very instrumental in getting this plan going in terms of reforming this. We're continue to explore ways to better communicate our action plans and quality improvement efforts to our entire team members. We've got a very robust workplace violence program launching almost right now, actually, along with some very significant improvements in how we respond to patients with behavioral health issues in the acute care hospital setting. We've expanded the sitter pool. Our nursing team has already gone way out ahead to reinvigorate handoffs and handovers, and we now have how many projects on throughput?
20-something.
20-something.
And growing.
And growing, to address the challenges of moving our patients through a system which can't grow larger at this time. So this is what we're doing with these survey results. So I just want you to know as the board that we have our eyes on this in a very serious way, and that we expect to do everything we can to make this improve.
The comment that I would make about this is when Rob was installed as the Chief Quality Officer in April, and I was installed as the Chief Clinical Officer at the same time, none of the results that came out of this survey were surprising to us. As we went about and did our listening tours and talking to individuals, we recognized that there was a great need for us to become much more proactive as an organization. And that's where many organizations are moving towards, to identify risk and vulnerabilities before they occur, and at the same time ensure that there is an appropriate forum for our staff and our employees to speak up about the issues that they see, and that when they do raise those issues, they feel it's done in a safe and effective environment where we also close the loop. So if they raise an issue, we go back to them and make sure that they know that they have been heard, listened to, and we are appropriately addressing it. So these results, not surprising. We'd already begun to put a lot of the action plans into place. And so when I look at these results, yeah, we would absolutely love to, to not see that only our 50+% of our employees feel like it's safe. But I do view it from the positive in the aspect that they felt comfortable, even on the survey, though, to raise that they felt that they weren't fully in an environment where they could speak openly. And that just still speaks to the very strong culture that it does exist here, that they want to get better. They want to have an environment where they feel like we can continue to improve upon all the great things that we do for our patients and our populations.
So I'll now take you through our hand hygiene results. We began a journey to improve hand hygiene a number of years ago, and as you can see, going back to fiscal year 2017, when this was identified as a specific challenge, although the number of observations was much smaller than what we're seeing presently, only our secret shoppers who watch people wash their hands found that was happening only 45% of the time. So that's pretty low number, because we really expect everybody to wash their hands going in and out of every room, and then now there's some other things recommended by CDC as well. But just going in and out of room, only 45% of the time. Mr. Early and others got very involved in a campaign to improve that, and as you can see, that number improved significantly over time. But there were, in addition to a very successful public relations campaign around hand hygiene, there were a lot of other efforts that went into place as well to help us get to that level of improvement. I will caution the board that there may be some overestimation in this number. Most people would, if you look at comparisons of these numbers and other methodologies of measurement, we may be at an overestimation, so we will see how that goes in the future. But in terms of improving going forward, because 90% is nice, but it's certainly not good enough, so we are going to continue to identify barriers. And by the barriers, like there are units where you have to walk halfway down the hall still to get to hand sanitizer. And so we need to tighten that up, and our IP team and others are working hard to see that happen. But we also need to continue to re-educate our staff, especially as CDC continues to modify its recommendations for this. And probably most importantly, we need to re-educate the hand hygiene observers so that the data that we're getting is really reliable data, which is still a bit of a concern. Any questions or comments? Okay, that's what I have.
Rob, thank you very much. I wanted to have Dr. Stevenson and Dr. Ahrq have that presentation to keep you guys up to date with where we are. And that's an ongoing process. That's an everyday process. And so we will keep you up to date. We will run it through the Quality Committee, and the Quality Committee will have that information. And we will keep a steady hand on that. Rob, thank you very much. I appreciate your time. Michael, thank you.
Rob, Michael, anything else? Good. Thank you very much for a great presentation. Yeah, Rob,
that was for Dr. Stevenson's
that's
presentation.
Don't get carried away, Michael. Yeah, anyway, Rob, thank you very much for the presentation, which brings us to agenda item number 9, which is our reports and committees. The first one, as you may recall, on October the 10th, I had the pleasure of appointing a nominating committee that would report back to this board today. That committee was comprised of former Chairman Ralph Emerson, former Chairman Trent Petty, and Amanda Arzola. And they met, and I received an email from Ralph. I know he could not be here today. And Trent, I will turn this over to you at this time.
Yes, sir. Thank you. And Ralph does extend his apologies for not being here. Thank you, Mr. Chairman. We have met and have had, I think, great results from the nominating committee. I will tell you that anytime anybody serves as an officer for our organization, it's a demanding role. And when you get into an officer position, you realize that. It's not always as evident as maybe you think it's going to be until you get in it. And I think JPS has had an incredible history of officers that have been willing to serve. And with that, I'd like to personally thank Mr. Wynn for the work that he does for this district and continues to do for this district. DT removed his name from consideration for the list today, and certainly respect him and his reasons for doing that, but also want to extend to him our thanks and tell him that we don't give him a break on this. He still has a great deal of work to do, and we plan on him continuing to do it. So with that, I can tell you that the nominating committee recommendation for chair will be Dr. Chuck Weber, Vice Chair Dorothy DuBose, and Secretary Roger Fisher. I'll be happy to answer any questions, Mr. Chairman.
If there's not any questions, I've got certain procedures I have to go by here, so I'll just say, first of all, I'll come back and thank the committee in a moment, but we now have a recommendation from the nominating committee, and therefore it comes as a motion from the nominating committee through Trent, so no second is really required. But before the board votes on the nominating committee's recommendations, I'm required by Robert's Rules of Order to offer an opportunity for any nominations from the floor for each officer position. So I have to go down each one of these, although we have recommendations. So I will ask the first, are there any nominations for chair other than those as presented by the nominating committee? There being none, I will move down and say, are there any nominations for vice chair other than those, other than that recommended by the nominating committee? There being none, is there any other nominations for secretary other than as presented by the nominating committee?
Can we get anybody other than Roger?
I'm sorry, sir, I'm sorry, sir, I'm not.
We actually thought it was afraid we were going to be you.
Yeah.
So we feel a whole lot better.
Yeah, I'm sorry, Mr.
All right.
Mr. Montgomery's a former,
I'll
as a
stick
former
with the
chairman, I'll
nominating
just say, you as a former chairman, I'll say that I'm not able to answer that question, but there not being any other nominations from the floor, I will definitely then call for a vote as a recommendation of the nominating committee at this time. All those in favor of saying aye for the slate as presented, please say aye.
Aye.
Opposed, no. Again, thank you so very much for the. Congratulations, Dorothy, congratulations, and
Maybe some other words.
yeah. Anyway, well, great. Again, Trent, again, to you and Amanda for being here. Thank y'all for the time. Y'all serve on various other committees, and I got an email from Ralph and thanked him yesterday, so thank y'all very much for that. Which brings us to the committee number B, which is the Finance Committee. And Mr. Montgomery, I think you'll give us an update for the 24th.
Yes, sir. We, Finance Committee had a wonderfully run meeting on the 24th of October. I don't know why Dorothy laughs every time I say that.
Well, we were there and we laughed during the meeting.
We were just trying to remember who chaired it.
No, we had a great committee meeting. We forwarded a lot of, several contracts for the board's consideration. Sharon gave us, and she's about to do it again, financial summary update, but it included the entire fiscal year from last year because it was through the end of September. So I think she's going to give us a quick overview right now.
Yeah, this is my pleasure to give you the year-end results for fiscal year 19 once again. We do close our year on September 30th. It's not a calendar year, so this is the full 12 months. And at this point in time, we expect this to be the final. But I think one of the more important numbers on the screen, I can't do it. It's harder than it looks, really. So now I can't color, but right there, that is one of the more important numbers I think that we focused on this year is actually being able to produce operating margin so we could make money from our core operating activities before our investment income. Of course, the number below here, which it's not letting me touch the screen there, but in bold, the net income of $32.8 million. Remember, we purchase close to $40 million worth of capital every year, so a lot of that cash is getting utilized for some of our operational needs. But and then also from an operating standpoint, our budget 20 is at 13.7, so we were really able to maintain that into 2020. But if there are any questions, I'll be happy to answer them, but I think most of you were here for that Finance Committee, and it was just a really good year.
Any questions for Sharon? Mr. Chairman, anything else?
Just recommend approval of, on the consent agenda of those contract items.
I do want to thank the finance team for their efforts, and I also want to thank you as board members. Those numbers don't come haphazardly, and that comes from a diligence on y'all. It helps with the direction that you gave us on the administration, and it comes from a team of 6,700 folks pulling in one direction, And Sharon, compliments to you as our CFO for that work. That is not a number to be taken lightly, and I'm very proud of you and the team and proud of everybody that works at this place, because there were times when you enlisted the team to tighten, and they did, and there were times that you went before the Leadership Connection and talked to folks and said, we've got to make a turn for the better, and they listened to you, and I'm thankful. So thank you, Steve, for the chair, and board members for the direction you've given us.
Sharon, thank you. Item number C would be the Governance Committee, and Mr. Fisher.
I can say a lot of accolades for the outstanding, wonderful Governance Committee. We met on October 24th as well. Items 11, J, and K are in the consent agenda, dealing with the Code of Conduct and Business Ethics, as well as the renewal of the Internal Audit Charter. We also discussed, and we'll bring up in the next governance meeting, formal orientation for new board members, and as well as how all board members will satisfy the requirements of the ethics policy when it comes to kind of continuing education. So we'll work on that through governance.
Any questions for Roger? And again, I want to thank Zim and Amanda, because there had not been as many new board members in the last few years. And with y'all coming on the board, it was evident that we probably need to expand the onboarding of new board members to the district. So thank y'all for y'all's comments, and we're going to leave that in governance and come back with a full policy on how we do that. So appreciate y'all's comments.
One other item,
on that.
Mr. Chairman, there was some question as to Acclaim and how they deal with the new business code of ethics. They have their own code of conduct, which also requires attestation that they got the JPS code of conduct as well.
Gotcha.
And that's checked annually.
Super. All right.
Chair, I'd just like to make this comment. I've been in 2 buildings in my life that I could get lost in a heartbeat. One of them is the Pentagon, and JPS holds the honor of the other one.
Probably coming in at number 1. I do understand. I don't know that our new orientation package will go the full length for you, but we'll try really hard to get the proper directions for you.
He needs a JPS locator.
Yeah.
Exactly.
All right. Thank you very much, Roger. Trent, obviously planning was very active with a lot of robust discussion, but you might want to update us on the November 7th.
Thank you, Mr. Chairman, and this was a joint board and planning committee, and the item was to consider the RFP. There was a lot of good feedback received on the RFP. It was ultimately adopted by the planning committee and the board, so it doesn't have to be voted on today, but it was forwarded to the county commissioners court for their consideration. So at least for now, I think we have that piece behind us.
Yes, sir.
But won't that come back to us?
No.
No, our
It will go to-
recommendations-
If there's any changes?
It will go to the commissioners court, and they'll make their changes. I don't think it comes back.
So, Trent, thank you. There's a lot of work put in on that with that committee and with you dealing with downtown. Robert, I know you and the staff were involved, but we, if y'all remember the joint meeting we had with the Commissioners Court, it's a pleasure, and I'm proud to say that this board and this staff, we met the required time parameters they put on us at that time, Robert. So good work on getting that done. Trent, thanks for your leadership on that. Item number 10, other matters requiring board discussion. I believe that Ms. Labby's fixing to be attending a lot of tax increment financing for us, but I'm going to let you run down each one of those, but you just want to.
Yeah, these are the tax increment financing district board appointments, and those will, we'll have J.R. Labby serving on those from her community outreach aspects, and she will serve in those capacities. So she will be attending those, and if there are items that come before those committees that those increment zones that need to come before the board, she will appropriately bring them to the board. If there's any decisions or vote taking of anything that would affect the hospital district, it will come before the board and for discussion.
Great. I'm advised we can take this in one motion, so I'd entertain a motion for JR to be appointed to those boards.
So moved.
I have a motion by Mr. Montgomery, second by Mrs. DeBose. All those in favor say aye. Aye. Opposed, no. Thank you very much.
Mr. Chairman?
Yes.
I'd just like to make one comment. I don't know what JR did to make y'all mad at her, but having some experience in the TIF committee organization and whatnot, that's a very time-consuming and a very complex and sometimes very political and emotional event. So I reach out to JR and say, we're sorry for anything you're about to go through. And if I can be of any help, let me know.
Well, she has 4 or 5 hours a day still available, so we thought we'd just load her up for that too. Point well made, Zim. Item number B, and Dr. Stevenson, I'd have you come back up and present item number B. Should we invite Michael up with him so he feels not just kidding. All yours, Rob.
Yeah, thank you for the opportunity to present this. So of the 3 things that we needed to do to qualify for all of the patient safety practices, all the safety practices that are required by Leapfrog, this is the final of the 3. So you've heard the first 2, which were the 2 items I presented to you earlier, and this is a never events policy. This is a very high-level policy. It's essentially prescribed by AHRQ and Leapfrog. What's in it is what has to be in it, nothing else. And we've set it up as basically a series of commitments that we have made to our patients and their families and to the process of dealing with these kinds of events. Following this, obviously, following this approval, we will have to operationalize this with a variety of procedures to make it possible to actually implement these things. But these are our commitments. If we were to have one before we have all the policies together, the procedures together, obviously we'll have to pull together a high-level team to make sure that we get the response right and we keep our commitments.
Super. Any discussions for Rob? If not, I'd entertain a motion. Have a motion by Zim, a second by DT. All those in favor say aye. Aye. Opposed, no. Thank you. Rob, C?
Sorry, I think it's the next item, right?
It is.
So I'll let you.
Item 10C, go ahead.
Yeah, so the second item is an annual reapproval of our infection control policy. There are some minor changes in that the written out, some things that were written out were replaced by abbreviations because they were repetitive in the policy. Otherwise, there's no substantive change.
Any discussion or any questions for Dr. Stevenson? If not, entertain a motion. Have a motion by Mr. Montgomery. Second by Dr. Weber. All those in favor say aye. Aye. Opposed, no. Rob, thank you again so very much. Appreciate it. Which takes us down to item number 10D. We're going to pull that off for discussion and close and come back out and consider that in a moment, which would take us then down to item number 11, which is the consent agenda. As you know, everything on here has been through committees and approved by those committees, and most of us attend any and all of those committees. Appreciate y'all's participation and all that. If there's any discussions or anything needs to be discussed off, be glad to pull it. If not, I know it was previously provided to you. If there's any questions, consider them. If not, I'd entertain a motion. I have a motion by Zim, a second by DT. All those in favor say aye. Opposed, no. Thank you very much. Item number 12 is report of legal counsel. Mr. Adams.
In accordance with Chair of Finance, there were, for the month of September 2019, there were 41 contracts under $500,000 that those contracts are listed on your website portal for your review. If you have any questions, give us a call.
Any questions concerning legal? If not, we'll consider that report, which will take us down to item number 13, which is basically our executive session. We don't think it'll be all that long for those visitors in the audience. You're certainly welcome to stay. Let's take a quick 5-minute break, and then we'll reconvene in close. Thank y'all very much.